this part of the lecture, let's talk about the adrenal gland, and then let's turn our attention to the reproductive system. Your adrenal gland, it secretes a bunch of hormones, but what we're going to focus on here are the steroids, the adrenal steroids. So, adrenal glands pump out, secrete glucocorticoids and mineralocorticoids. And our glucocorticoids we can give as medications as well, these exogenous medications. And what do we give these for? Well, we can replace these glucocorticoids for adrenal insufficiency. So if our adrenal glands aren't functioning the way they should, we can give glucocorticoids. If their adrenal glands aren't functioning the way they should, that's called Addison's disease, and we're going to give these glucocorticoids. We can give these as anti-inflammatories, so or anti-inflammatory steroids. We can give glucocorticoids, also given in cancers as adjunctive therapies. Certain respiratory conditions, we can give glucocorticoids as well anti-inflammatory steroids, and in certain dermatologic conditions, again as anti-inflammatory. So our glucocorticoids should be excreted by our adrenal glands. If they're not, we can give them as replacement therapy, or we can give them in other cases as anti-inflammatory medications. Looking at our glucocorticoid medications themselves, we've got short-acting medications, we've got intermediate-acting medications, we have long-acting glucocorticoid medications as well. So our short-acting ones, I'm sure you've heard of these, cortisone and hydrocortisone, very short acting corticoids, right? I just took some hydrocortisone. I just put it on my arm the other day because I got a little bit of poison ivy. Great anti-inflammatory for that. For that reason, it's short acting. It's anti-inflammatory. It cuts down on the symptoms and longevity of that poison ivy, right? Then we get into intermediate acting. We have prednisone. Patient might be prescribed prednisone, and methylprednisolone. Probably recognize methylprednisolone as a medication that we carry on our trucks. That is solumedrol. It's a glucocorticoid and is an intermediate acting glucocorticoid. So doesn't last too long, doesn't last too short. It's just right. That's our solumedrol or methylprednisolone. Our long-acting glucocorticoid, dexamethasone. Some agencies also carry this on their trucks. You definitely see this in the hospital, in the ICUs, maybe the ED. You'll see this on critical care trucks. Dexamethasone, glucocorticoid, but it's a long-acting glucocorticoid. What about our mineralocorticoids? Well, we're not really going to focus too much on those. We're going to focus more on our glucocorticoids because those are the ones that we're going to see our patients prescribe the most and the ones we're going to be giving as paramedics. But here, these, block, or excuse me, not block sodium reabsorption, but cause sodium reabsorption in the kidneys. And this is, spironolactone. Your patient might be prescribed spironolactone, and spironolactone has kind of checked off a lot of classifications of medication here. So it's used for heart failure. If you have hyperaldosteronism, right? So we have an aldosterone issue, too much of it. Spironolactone is an aldosterone blocker. It's used for heart failure, used as a diuretic, sometimes used for high blood pressure. But it's all about sodium reabsorption in the kidneys. So a mineralocorticoid, think spironolactone. Now let's talk about the reproductive system and some medications that are associated and concerned with our reproductive systems. Many of our reproductive drugs aim to mimic the biologic effects of our normal hormones, our endogenous hormones. So we're trying to supplement maybe inadequate hormone production maybe we're trying to correct some hormonal imbalance. And then reproductive drugs. We can't talk about this without talking contraception. So, three groups of steroids in our reproductive system. We have estrogens, we have progestins, and we have androgens. Most commonly, a patient's going to be prescribed some sort of estrogen, and estrogen goes into oral contraception. Sometimes it's used for acne, so kind of overactive acne. You can use estrogen for it, or just simple hormone replacement. Remember, we can use these steroids as hormone replacement, but oral contraception is the most common use of estrogen, and what it does is it inhibits ovulation. Um, we can give it in kind of younger populations if need be to develop those sex organs and characteristics. Estrogen can also be used to facilitate labor. If we're trying to induce labor, we can give estrogen, but most common use for estrogen is oral contraception because it inhibits lactation, inhibits ovulation. Couple types of estrogen that will give medicinally, that will give as a medication. Some are natural, like Premarin. This is derived from horses. It is equine derived, is naturally derived from animals, from horses. And Premarin is typically given for hormone replacement. So you just need a little bit extra estrogen to kind of balance your bodily systems. Well, we'll give you Premarin. And then there are synthetic forms of estrogen, and these are the ones that are used in contraceptives because they're much more potent. So our potent synthetic estrogens are going to be used in our contraceptive medications. Nowadays, our contraceptive medications are oral contraceptive medications, which we're focusing on here, aren't 100% estrogen. They're usually a combination of estrogen and progestin. And what these do in combination, they prevent ovulation, they change cervical mucus levels, and then delay maturation of that endometrium. So this all kind of delays and prevents pregnancy, delays maturation, changes in that cervical mucus can't hold on to a fertilized ovum, right? So our oral contraceptives, that's how they work. So estrogen plus progestin, but these medications aren't always prescribed for contraception. They can also be used for, we mentioned acne, right? So just pretty bad acne, but also prescribed for very painful, irregular menstrual cycles. Can be used as emergency contraception as well. But you might see patients on this for just, their menstrual cycles, their menstruation is just painful, it's irregular, it's got endometriosis. What do I do? Well, we can put you on these oral contraceptives, which in that case aren't contraceptives, but they are treating this condition because they are affecting your cervical mucus. They're affecting the maturation of your endometrium and affecting ovulation. Then we also have erectile dysfunction drugs. Viagra, Cialis, Levitra are the most common types to use for erectile dysfunction. These are nitrates. Remember that they are nitrates, please. And in combination with nitroglycerin or isosorbide, they're going to have this synergistic effect. So all of these drugs are used for erectile dysfunction, but are nitrates. So please, if you don't take anything else from this slide, remember that these drugs are nitrates and do not give them or give nitroglycerin or isosorbide in combination with this medication. If you have any questions, comments, concerns, or cuss words, please let me know.